Hello and welcome to Health Assay. I'm your host, Amazing Tife. Now, the Nigerian healthcare industry has become increasingly attractive to private and institutional investors due to several factors. And with a population of over 200 million people, Nigeria represents a significant market for healthcare products and services. Now, the country's healthcare sector is also undergoing significant growth and development, driven by government initiative and increased investment. Additionally, the rise of chronic diseases such as diabetes, hypertension is creating a need for specialized healthcare services and presenting an opportunity for investors to tap into the growing market. Now, despite some of the challenges, including a shortage of healthcare practitioners and infrastructure, the Nigerian healthcare industries offer investors the potential for significant returns and impact in a sector that is critical to the country's economic and social development. Now, joining me as we continue this conversation is Adesegun Damazio. Adesegun is a corporate industry professional with sound experience building sustainable businesses and delivering growth, strategy, communications, and marketing solutions for innovative brands. Over the past couple of years, he has successfully handled high level and strategic business development duties at clinical health, brand consulting, health insurance, health financing, and investments and insurtech organizations. Adesegun holds a bachelor's degree in physiotherapy from the College of Medicine, University of Lagos. He is a certified business analyst professional, a financial model and evaluation analyst, and a project management professional. He is currently the group head of marketing and growth at Ibuso Investment, a healthcare investment company dedicated to investing in Nigerian healthcare markets. Hi, Adesegun. It's nice to meet you again. It's nice having you here. So just introduce yourself. Let us meet you. Let's
All right, thank you very much. So my name is Adesegun Damazio, Group Head Marketing and Growth at Ibuso Investments Limited. So Ibuso Investments is a private healthcare company dedicated to investing in healthcare markets in Nigeria. So we're currently a parent holding company for Ibuso Lagoon Hospitals, the leading private tertiary healthcare provider in Nigeria. And we're currently operating basically Lagos right now, but we are looking at interest in private clinics as well as diagnostic facilities, laboratories, medical parks, training schools, and the likes of them. So happy to be here.
So, investment in healthcare. We've seen a lot of investments and investors coming into the Nigerian healthcare space. And so, I'm wondering, from your own perspective, what do you think makes Nigerian healthcare space very interesting for investors to come in?
Okay, so over the years, or shall I say, over the last couple of months, we've seen a lot of interesting news come out of the healthcare sector, particularly with regards to, I say, healthcare startups raising funds, Series A, Series B, and all the series you can think of. And you see, the interesting thing is what investors or what private investors, including the foreign organizations, can see in Nigeria is that there is a behemoth of opportunities present here. And these opportunities cut across different value chains of the health sector. Because you have the clinical side, you have the diagnostic side, you have things even including wearables. I mean, we have healthcare startups involved in genomics, biotechnology, and the like. So they can see that number one, there is a substantial market for it by the sheer size of our population alone. There is already a huge market, and also they can see that Nigeria is also a tech hub of some sort. I mean, in Africa right now, Nigeria is arguably number one, and you can see that from the quality of super talents we put out. That's all. Will I say those talents also somehow play in the healthcare space? We have a lot of medically trained professionals from different backgrounds the healthcare industry also ply their trade in tech. So that alliance, basically between tech and healthcare, has really also spurred the growth of investment in this part of the world. And one thing that really also stands out amongst all of these brands is that each one of them is trying to deliver a very specific and untapped value that the market critically needs. So all of these things are quite noticeable, and you can see a lot of investors pay strong attention. And I mean, just I think in 2021, healthcare accounted for just less than 4% of funding raised by African startups,
Yes.
but that number is expected to grow. And so the interesting thing is, I think the numbers for 2022 are not yet out. I mean, we're still in February, but we assume that before the end of Q1 2023, that's in March, or shall I say early Q2, the numbers, we're going to see more numbers. But definitely there are lots of interesting stuff coming out of the healthcare space. And again, these are things that organizations and investors, be it private or institutional investors, paying strong attention to.
Alright.
So yeah, there's a lot of potentials up ahead.
Okay, so from your perspective, what is the current state of the Nigerian healthcare system, and what improvements can be made to attract more investments?
Well, I think, let me be honest, for lack of, or for avoidance of any negativity, I would say we are not where we were 10 years ago, obviously. I mean, there's been a lot of significant improvements across the healthcare space. I mean, you hear of things like health insurance, you hear of things like genomics, like I said earlier, you hear of things like wearables, and you also see a lot of organizations adopt EMR and all kinds of things. At least that's from the organizational perspective. From the individual perspective, I would say also that we've seen, shall I say, slight improvements in the health seeking habits of the average Nigerian. I mean, I would say back then, everybody more or less just used to move with the flow. And the only time when you go to the hospital is probably when you're really down bad. But now we're seeing an increase in demand for preventive healthcare. People want to go for wellness services, they want to go for comprehensive screenings, they want to go for interesting stuff. And also, to be fair, on the legislative, or shall I say on the policy side too, we've seen good advancements being made. I mean, for instance, a couple of days ago, I was at a conference organized by the Healthcare Federation of Nigeria, and in attendance was the chairman Senate Committee on Healthcare, Senator the Minister of Health, Dr. Sage Ehamiri, was also there, and quite a number of discussions were had regarding how far we've come in the last couple of years, and we can actually see for sure that we've made good strides. We've seen an increase in the number of standard healthcare facilities. Could be secondary, could be private. Could be secondary, could be private. And we've also seen some advancements, or will I say, some refurbishments being done to the existing primary healthcare facilities that we have in the country. So over the last couple of years, I'll say not so bad, but there's significant room for improvement.
Hey, interesting. That's beautiful. And what are the main factors that makes healthcare business attractive to private and institutional investors?
Okay, I think so. That's quite a buzzing question right now among, let's say, healthcare stakeholders, because
Yes.
I mean, you literally see everybody trying to just, let's say, scamper for what's available in the funding market. But you see, it's quite interesting because now private equity is also leading towards healthcare. I mean, you have the also investment, for instance, investing real big in healthcare infrastructure, clinical outcomes, healthcare excellence, and the likes. You also have other groups, I mean, of Evercare,
Yeah.
and quite a number of them. We're seeing interesting stuff playing across board. And what you also see now is a lot of traditional healthcare facilities are trying to move from that sole proprietorship form of business whereby the Oga at the top is the medical director, he is the accountant, he's the receptionist, he's the marketer, he is the everything.
Yeah.
So right now, to attract tangible funding, or let's not even go into funding, to attract the right kind of interest, the right kind of attention from private and institutional investors. These can be homegrown.
Yeah.
This could also be international. It really doesn't matter. But what they critically look out for is they want to see an establishment that pays strong attention to process. And what process basically entails in this case is having a standardized corporate governance model. And what that means is there is a structure. We can see how your operations function. You can see how your clinical provision function. You can see how your marketing team function, how your quality and governance team function. In some cases, we have a sustainability team, your ESG team, and the likes. They want to see that you have paid strong attention to process. Then they also want to see how well you use your data. Now, it's not enough for you to just have the right equipment or to just have skilled personnel. They want to know what exactly informs your everyday decisions. And you see right now a lot of people quip that data speaks. The numbers always speak.
Yeah.
You can manipulate data to speak a lot of languages. I mean, not to sound prophetic, but that's really the power of data. That's what data does. So if as a healthcare organization you can establish the fact that data informs every facet of your business, then you can see that you will see rather that you will get the right kind of attention. And for instance, you see quite a number of hospitals now adopt the use of EMR.
Yes.
I would say even as far back as 6 years ago, EMR was probably some futuristic technology which Nigerian hospitals hoped to adopt.
Yeah.
But now, everybody is trying to have a piece of it. Of course, there are still some organizations stuck in traditional pen and paper model, but EMR, I'm using EMR as a classical example because what we have seen EMR do, maybe the right kind of EMR by the way, what we've seen it do is it has really helped simplify, or will I say, made life easy for not just the healthcare providers themselves, but also the patients who have to come and receive access. Because usually with a click of a button, we can pull up the patient's record, see their medical history, and all of these things are usually domiciled in the cloud.
Yeah.
So having different software that you're embedding into your system and feeding it into your EMR just creates a very seamless loop, which basically is the point anyway. So speaking about having your corporate governance model in place, speaking about the use of data, they also want to see, and I would say most importantly, the attention you pay to quality of care that you're delivering. Because really, all of these data, all your corporate governance model will mean absolutely nothing if the standard of care delivered or provided at your facility is nothing to write them about. So I would say those three key things are core pillars. Of course, there are several other facets that can be outlined, but I think those three key things. Of course, the finance people would then tell you that look, they will also want to see what your propensity for growth is. Of course, every investor wants to know that what they're investing in is what they are worth. So the propensity for growth or your growth trajectory is also something that has to be well demonstrated. So those are key things. I feel like there's only so much you can do, but the three key things that you must get right are the things that I have mentioned, because it makes life easy for you, like I said, for the patients, and then for the outsiders, that's the investors who want to take an inside look at your business.
Okay, yeah, very good. And what role do you believe that regulatory policies and reforms play in the attractiveness of the healthcare business to investors?
Yeah, so of course, every organization is governed by the regulatory authority, and healthcare is not an exception.
Yes.
Right now, I mentioned earlier that at the conference that I attended a couple of days ago, I mean, we had to give a standing ovation to the Senate Health Committee chairman, Ibrahim Olori, because during his time, I mean, since he was elected so 4 years ago, I think it's going to be his last tenure anyway. During his own time, we have successfully passed, or he has successfully passed three crucial healthcare related bills. I mean, I'll for the sake of curiosity, I'll perhaps ask the viewers at home to go do some quick homework on which bills those are. But there are three fundamental things he has been able to pass across. So those, so things like that. I mean, so a clue, by the way, is the Health Insurance Act. So
Yeah.
things like that do well to promote investor confidence. And you see, that's number one. Number two also is, yeah, so in attendance was also the Deputy Comptroller General of Nigerian Customs. And he spoke extensively on what efforts are being made by the Nigerian Customs to ensure that critical items are seamlessly imported into the country. Of course, we know the likes of Form M. I mean, that basically applies to importers of products, of which healthcare business owners also fall among. If you import your medical equipment,
Yeah.
of course, you have to go to the bank, apply for your Form M, so that you can get your FX at the CBN rate and against the black market. See, policies like that would really help to, shall I say, assuage the pains or the headaches felt by not just business owners now, but also the investors. I mean, investors want to see that if they invest in a business, no single policy or no government body will just wake up and then, with the stroke of a pen, wipe out the entire investment. They want to see a country or a system that pays strong attention to the advancement of healthcare. I would say Nigeria hasn't particularly been upbeat about that, because when you look at how much of our GDP is committed to healthcare spend, you see that it's still pale in comparison to several other African countries, not even the international, the European or the North American countries right now. It's Africa alone. And you see that is because I think at the African Union gathering, this was about well over 15 years ago. I mean, there was a kind of pact agreed to by African leaders where they said, okay, at least 15% of country's GDP should be dedicated to healthcare. But so far, Nigeria, we have just covered roughly, we've danced around 3-4%. And when you look at just how much resources are being committed to, shall I say, non-essential endeavors, you see that that commitment is still questionable.
Yes.
But like I mentioned, the private sector has done significantly well to bolster the development of healthcare in Nigeria. Not just healthcare now, but primary, secondary, tertiary, and very soon quaternary care. Because really, the whole idea of this attention that we're paying to healthcare development is to ensure that, or to in a way stem the tide of medical tourism. I mean, it was said just a couple of years ago that Nigerians spent well over $1 billion in 2021 on medical tourism, and roughly 9,000 Nigerians traveled out for one healthcare service or the other, and more than 90% of them went to India. Of course, there's a population that goes to several other places as well, Cuba, South Africa and the likes. But just imagine $1 billion, at least as at the time of this discussion. We know that USD in the parallel market is about exchange for about 7.45. Now, when you do a quick math, so $1 billion to naira, that's about 745 billion naira. I mean, that's a lot of money that Nigerian healthcare organizations can do. I mean, quite recently, we saw in the news the famous Dr. Egemba, local doctor.
Yeah.
He came out to speak about how he had his craniopharyngeal surgery done at Lagoon Hospital.
Yeah.
And this is just one of several complex cases that are being handled by homegrown organizations. And I'm using Lagoon as of course, because of my own preference for the organization. But from where I sit, I've seen quite a whole lot of super specialty services, complex procedures done at Lagoon in the most minimally invasive manner. And you also see several other organizations try to replicate things like that. See, our own businesses, our Nigerian businesses, or indigenous businesses rather, can make good use of that $745 billion. I mean, there's absolutely no reason why. I mean, if you were to chronicle the kind of procedures or services that Nigerians go out there to get, you'll see that not less than 90% of the services are available here. So, access to information is something that is quite key, but for sure, we know that the opportunities are there, like I said, and it would only get better. So just to be optimistic, it will only get better.
Okay, and then let's just quickly move on to the next question. So, in your opinion, what are the promising areas in healthcare business that you think that investors can consider?
Well, so there are quite a number of them, but for the sake of practicability, because I obviously wouldn't want to go into AI and all of these things are quite futuristic for now. Number one, I would say is really health insurance. So I think about last week, I was at a session hosted by an organization, and it was primarily centered around prospects of health insurance here in Nigeria. And I can tell you for a fact, any foreign organization who makes a grand entry into the country by simplifying by further simplifying and democratizing healthcare insurance is bound to win big. Because right now, you know full well that less than 4% of the entire populace are insured.
Yeah.
And so let's even break down the numbers. We have well over 200 million persons living in Nigeria right now. So let's peg that at 200 million. And it's reported that more than 120 million Nigerians live below poverty line. Good. So that leaves us with just about 18 million. So let's do plus or minus. They then say that healthcare insurance penetration is at about 4%. What you still see is that there is a substantial market for health insurance. So it doesn't matter whether you want to do, it doesn't matter what kind of cover you now want to bring on board, but you know full well that tailoring your health insurance products to attract various segments of the Nigerian consumer demographic would go a long way. And of course, the HMOs in the country have also done a significant job of making sure that this thing is made readily accessible. But then there's also the problem, perhaps we can discuss this at another session. They've also figured that perhaps maybe there is a problem that exists between the healthcare providers, that's the hospitals, and then the HMO themselves. I mean, we've heard stories where they are constantly at loggerheads. There have also been very positive stories. We're also seeing collaborations among them. So, quite frankly, health insurance is quite key because what it does is it ensures that it drives up patronage, to put it that way. Knowing full well that you have standard health insurance cover means that you can rest assured of getting quality service at a standard hospital any day, anytime. And what that does is you pay for health insurance at whatever rate it is you agree with the new market entrant. Pay for it, go to access care, and then a foreign guy who is doing the health insurance business for you, I mean by the advantage of him coming into the soil, of course he's at a currency advantage. So obviously bringing a higher currency. So chances are that they will be able to provide a larger bandwidth of services, including the commonly excluded services. They'll be able to provide this and maybe passing on the tapped or the untapped segment that the current crop of health maintenance organizations are yet to happen to. So it's a lot of opportunities. So, I mean, I think insurance in particular stands out in my opinion.
So how do you see technology impacting the development of healthcare industry in Nigeria?
Well, I think that's quite self-explanatory from the conversations we've had. I've spoken about the benefits that the EMR system brought on board. That's the electronic medical record system. We've spoken about how it beefs up the efficiency of data and how that data can be interpreted to serve the better good of the organization. So I think for starters, where we are right now, of course, there is opportunity for wearable devices, implants, and all those sci-fi AI things, but really, I think getting EMR adoption to as high up as 90% is something, and not just for private organizations now. This adoption should be mass adoption. So you want to go into a standard primary healthcare center at Ekweda or at Newi or wherever, and you want to see people punching keyboards and all of that. That's really where mass adoption can start from. So of course, the private organizations, the big names will always readily have it. Already, most of them have adopted it, but you see all of those other areas. So that's where bulk of the healthcare consumers go to. So that's mass adoption. Of course, the function of technological advancement. So I think EMR for starters, let's even get that adoption, let's even get that footprint right. And then we can go into wearables, artificial intelligence, and all kinds of great technology.
Okay, so final question. Okay, give me the final question. How does the availability of skilled healthcare professionals in Nigeria affect the investment opportunities in this industry?
Okay, so that's also a very good question because the quote and unquote GAPA syndrome is it cuts across all professions, be it medicine, be it tech, wherever. I mean, a lot of Nigerians are living in droves day by day, Canada, US, UK, and the likes. And what that creates is a perennial problem of deficits in clinical training. Because what you would also find out is that a staggering percentage of these immigrants are the skilled clinical professionals who are meant to be training the young ones. And then what that also portends is the market or the availability of experts becomes really scarce. And for a private investor, he or she would be thinking, wouldn't it be cheaper to source talent on the ground than for them to bring talent from their domain? Because, of course, not to say talent here are cheap, but by the time you look at the cost of bringing this person in, accommodation and the likes, it tends, you trunk the numbers and you can see that it's already eating into whatever profit margins that you're looking to set up for yourself. So we can have a situation whereby we build systems, not just build, we maintain, sustain systems that are deemed hospitable and habitable for medical professionals. What we are going to see is that many private investors. That's the broad term. Many investors will see that this is not just a gold mine where there are several, there is a large population to cater to. They also see that there is that, there is a paradise of talent from which they can pull from. And what you then see is the emergence of super specialized healthcare services. Right now, we've been doing a lot of secondary, tertiary care, trying to move into quaternary care. But also, there are several other highly specialized sectors or highly specialized fields in clinical healthcare where things are really untapped. We'll hear things like molecular biogenetics. The other day at the conference, and an electrocardiophysiologist spoke, and he said he doesn't think there is any of such person here in Nigeria. And chances are that he might be right. I'm not able to fact check, but chances are that when you dig deep into the different super specialty services of medicine or clinical care, you'll see that, quite frankly, we're lagging. And I think someone else also said that right there in some advanced countries, you have nurses carrying out highly specialized procedures like colonoscopy. And then that begs the question of how well are we even training these medical professionals, not just the doctors now, the pharmacists. Chances are that what you will find is that most of these young professionals like you and I and every other person out there have yet to maximize the potentials that they get. Most of these things they read in books, and many of us do not even think that these feats are achievable. But where adequate attention is paid training the talents, and this is where several, I'd say some notable private organizations are trying to build efforts in. For instance, at Lagoon, we recently announced that we have earned our accreditation to train radiographers. Now we can train nurses, that's for their internships, and very soon we'll be looking to train medical doctors. So, you see, most of these highly specialized procedures are done by homegrown talent. So, in the event that this super specialist can train those, coming up, what you are going to see that he may or may not stem the immigration tide, but what it then does is it expands the range of options available to investors who want to enter the market and also invest in hiring homegrown talent. So I think clinical training, we can pay strong attention to clinical training, pay strong attention to, let's say, maximizing the healthcare reforms that we have on the table, and as well as building viable healthcare institutions that are going to stand the test of time. And not that once maybe you lose your political sense or once you're about to hand over to somebody, everything becomes comatose. Then you will start to see, we will start to see very, very appreciable advancement. Of course, a lot is being done by the PPP scheme, that's the public-private partnerships. We need more of that. There have been there are several success stories. They are found well over the country. And what we see is, by the time you count them, you can literally count them on just one hand. Whereas we have a population of close to 200 million, and it's a huge base. There are 36 states, and what you would even see is that most of these standard healthcare services are highly concentrated only in the most developed cities like Lagos, Abuja, for that, but then it's not enough. We need the more centers of excellence that we have in the country, the better it is, and the more motivating it is for even aspiring medical professionals who train. But then they know they don't necessarily have to fly to Lagos all the way from Zamfara or go all the way to Abuja from Sokoto. It makes things easy. So democratizing the entire healthcare value chain by making committed investment into healthcare infrastructure, healthcare technology, usable technology, by the way, not just fancy technology. And then, more especially, healthcare insurance. We will see that, and then we will be able to jump from point A to point Y if possible. So those are the options. I mean, I'm quite optimistic. Like I said, in the past couple of weeks, sorry, the past couple of months, years, a lot of things have happened, and all of this just go to show that healthcare really, maybe it's not going to be the new oil. I mean, I wouldn't be so optimistic to say healthcare is the new oil. I mean, though people say tech is the new oil or whatever it is, but I strongly believe that healthcare will be a top contender for global talents, not just healthcare in Nigeria. You know, not just for medical professionals themselves, but for everybody.
Right. Okay. Thank you, Addition. It has been lovely having this conversation with you. And we hope to see, or I hope to see more achievements in healthcare in Nigeria, healthcare business, and hopefully more investors will find Nigeria healthcare industry very
That's our prayer.
profitable.
That's our prayer.
There you have it, as it said. Overall, the Nigerian healthcare industry presents a promising investment opportunity for private and institutional investors looking to make impact while generating significant returns. Now, with the government's commitment to improving healthcare, there is a growing market for healthcare products and services, and there is a need for specialized healthcare solutions. There's also potential for investors to contribute to the development of a more sustainable and accessible healthcare system in Nigeria. Now, while there might be several challenges to navigate, the opportunity for impact and growth in the Nigerian healthcare industry makes it a compelling investment prospect for those interested in making a difference in this critical sector. All right, so this is the end of today's episode of Health Assay. If you've enjoyed it, remember to like and also subscribe if you haven't. And you can also follow me on social media at Amazing to Fair. You can also share with your friends, your colleagues, and your family members. And until I come your way again on the next episode of Health Assay, cheers and stay safe. Bye bye.